other stage, at least you will know that what you need to speak, what you don't need to speak. So our role is more into decision making when you're working in a team environment. How do you manage your time? How do you manage the players? Obviously, everybody will have their own egos. How do you manage them? And at the same time, we need to keep ourselves updated what's happening, latest what's happening, because players are exposed to different physios at different stages in their career. Okay, they'll go to a state team physio, they'll play for their state. The state team physio will do something. Then they'll go to India A, that physio will do something. Then they'll go to IPL, that physio will do something. Then he will come to you. So there might be some treatments where the other physios has done which has suited them, and they'll come and ask you, I need this. That time you can't say, no, I don't know how to do this. So we have to be well versed with whatever latest trends are there in the field, so that when a player comes and asks from you, we should be in a position to deliver that. Yes, you might have your own preferences in terms of treatment. Some might want to do only manual therapy, some might want to do only dry needling. Some physios don't like manual therapy at all. They are completely hands-off. You can have your own choices, but it is important that we are open to what is happening in the field, in the market. Suddenly a player might come and tell, you know what, the IPL physio did blood flow restriction for me, it worked really well for me. That time we can't go and tell, no, I don't know to do blood flow restriction. And sometimes it is just playing in their minds. If it is a soft tissue injury, we have only a few minutes to quickly assess it. Okay. Say for example, someone is running for a quick run. He pulls his hamstring and you're called in. The first thing you need to ask is, did you feel a sound? Okay. If the athlete says, yes, I felt a sound, you know there's some structural damage that has happened there. Second things you need to figure out if there was any contributing factor from the back, from the lumbar spine. Before the game, if the athlete had come to you for some lumbar spine moves or lumbar spine stiffness or some hip stiffness, you know, okay, this is a secondary issue which has happened because of some issue in the lumbar spine and the hip that has gone on to affect the athlete's hamstring. Third thing, did the athlete have any cramping episode preceding to that injury? Once you do your basic assessments, I mean, obviously we can't do much on the field, okay, like your basic active leg extension, quickly do a resisted test and see how they feel. Now again, that decision depends on the importance of a game. Okay, if this is the final of a tournament, okay, even if the athlete plays and if the injury aggravates, okay, you push the athlete, let them play. But you have to give the assurance, give the awareness to the athlete. Boss, we will tape you up, we will do everything, but there's a good chance that this can aggravate and you might be out for a longer period of time. If the athlete says, yes, I prepare for that, do whatever treatment needs to be done, taping, whatever needs to be done, do it, and then come and inform the captain and the coach that this is what you feel. I will inform the player, you're also in the group, what has happened. This is the scenario. One is, say, it's a final of a big tournament, you allow them to play. The same situation, if it is the first game of the tournament, okay, you've got some important game coming up after this. In that situation, you would rather have the athlete pull out of the game. Okay, you do a proper assessment, get a scan done, rehab them properly, and then get them ready for the.
Like how it inspired me to take up the profession. Like for him, like he said, Andrew Lepus or something. Like go and Google about it, right? So it is all about how innovative you are and how quickly you think on that minute, right? You have to be think on your feet, like they say. So like that, hope his talk to you all inspires you to reach higher heights. Like I told you in the introduction, it is a steady climb, right? Nobody jumps up there without having hard to work for it. A lot of sacrifices, a lot of sleepless nights, like how we do some intervention, we don't know how the patient will react the next day, so like that. So it is a big eye-opener for these kids. I hope you see them the other way around in a few years.